Well, with me is Harry Quilter-Pinner, a Senior Research Fellow at the Institute for Public Policy Research, a progressive think tank which has expertise in social and economic policy. Thank you for coming in this evening. First off, just how bad is the social care crisis?
Well, it's very serious indeed. Since 2010, we've seen significant cuts. We still aren't at the same level of spending as we were in 2010. And what that's resulted in is hundreds of thousands of people less getting state support for their care at a time when we've got more older people and more need. And there are now over 1 million people who need care out there but are not receiving it.
2010 levels, were they enough in the first place? We're referring back to 2010. Was that ever enough?
No, for a long time now we've been talking about the need for a long-term funding settlement for social care, a long-term solution in the way that we have for the NHS. And successive politicians from New Labour onwards have failed to grapple with this issue. They've said it's a priority, but they've failed to come up with a long-term solution. So we're still not getting the level of funding and the kind of solutions we need. Okay,
when we talk about solutions, looking into social care and how society has changed, it seems to be a very complex picture. Just take us through the dimensions of social care, for example, for the elderly, because it's very different, isn't it, for different age groups?
Yeah, so I mean, people might need social care when they're younger if they have a disability or need care in the home. But actually, the big challenge we face is as we get older, we've got an ageing population. We've got more and more people who need support to live independently, to get up, to get dressed, to get food. And the social care system is supposed to provide that, but actually it's failing to do that, and we've got too many people that aren't getting the care they need.
Okay, so by not providing that, what sort of impact is this having on society?
So if you can afford it, it means that you're paying for it yourself. You're paying for it potentially out of your savings or out of your housing wealth. But actually the majority of people are relying on family and friends and carers, or they're simply going without. They are struggling day in, day out to live. And that's why, for example, we see more people going into hospital with having fallen over in their homes, for example, because they haven't got the care and the support they need to make sure that they can live independently.
Okay, the Prime Minister says that the money will be guaranteed for the next 5 years. Is that figure realistic? He mentioned an extra £1 billion a year for 5 years. Do those figures add up?
Not at all. I mean, we estimate, or for proposals that IPPR put forward, which is essentially to put money back into the system to reverse the cuts and to meet just demand, but also to extend the entitlement. So we've called for free personal care. What that would mean is the care that you receive in the home, if you're elderly and need social care, would be free at the point of need, just like the NHS. And we've said that means by 2030, so in the next decade, we'd have to almost double the amount we're spending. It's almost an extra £20 billion per year.
Do you know what strikes me about this is the Prime Minister spoke primarily about the elderly, and yes, there is a crisis there. But I was looking at examples of social care budgets, and in Merseyside, Knowsley Council said that there is an increasing demand, and their children's social care budget is forecast to be nearly £1 million over budget. Yeah. How big a crisis is there for children's social care?
It's huge. I mean, what we've got is more and more people who are living when they would have tragically died young of disabilities, which is a great success story, but it means that we need ongoing support for people as they get older throughout their life to be able to maintain a healthy and happy life. So it's huge. A lot of local authorities are saying that's now the biggest pressure on their budgets. So, for example, the Labour Party have endorsed IPPR's recommendations for free personal care for over 65s. That's great. They haven't yet made a commitment on people who are working age or children, and that's got to be a priority. Okay,
very quickly, where do you start and how do you start to fix the crisis? Once you get the money, where should it go first off?
A great question. We've talked for so long about the funding, we haven't talked about reform. Social care is all about the relationship. There's no fancy drugs, there's no fancy equipment, it's about the relationship you build with the carer. So the money really needs to go to the workforce. We have a tragically underpaid sector. Around half of care workers earn less than the living wage. So we have to make sure that those staff are properly trained, are properly paid, and have the skills and the time they need to care for our elderly people.
Harry Quilter-Pinner, thank you so much for that insight. Thank you.
Pleasure.
Thanks.